Welcome to OrthoStatic, a podcast brought to you by the Academy of Orthopaedic Physical Therapy. Patrick Berner is on the show today. Patrick, welcome to the program.
Oh, I appreciate it, Jimmy. Thanks for having me.
You're no stranger to talking about the topics we're going to get into today because you have, and I remember the first time we met in person, you have an interesting background. How do you explain to our audience, or how would you explain to people? You've got this sort of cool mashup of backgrounds. Help people understand that.
Yeah, so, it probably originally stems from me being born and raised in New Orleans and being surrounded by people living with, systemic chronic disease. So a food around passion around food started up, right? So that's where my professional journey started, was looking at what people ate and how it impacted their health and outcomes. But I started to learn that there was a movement component to people's outcomes, and that's what led me to the profession of physical therapy. But then I realized that most PTs, and especially your orthopedic PTs, only look at that movement component, only look at that pain or functional deficit. And it was frustrating. So I actually went back and did an internship and sat for board. So I was able to become a registered dietitian in addition to being a physical therapist.
That's great. And you get to look at, we talk about this clinical toolbox a lot. And there is a cliche that says, when all you have is a hammer, the world is full of nails, right? So maybe just always only looking at movement and not considering some of the other things like nutrition or sleep or mental health or stress. Hey, we might be missing some of those things. So this episode is really just a reminder, and you're going to give us some tactical information of maybe if I don't have the background of Patrick, how do I begin to sort of ask some of those questions and why it's important? So let's start with, how important is nutrition in orthopedic physical therapy outcomes? Where would we start there?
Yeah, I think, the thing, Jimmy, is I'm super biased, but it's extremely important.
Yeah.
If you look at those outcomes, whether you're an orthopedic therapist trying to facilitate improvements in strength, or you're trying to facilitate wound healing versus some type of surgery, you're thinking all your post-op patients, joint replacements, ACL repairs, etc. If you're trying to facilitate the system to recover, well, you got to fuel the system appropriately in order to do so. And that's where nutrition comes into play. It really helps support the interventions that therapist is implementing in their plan of care to get the person where they need to be more efficiently, and I think really set the patient up for other success as well in their overall health outcomes.
Yeah. All right, so let's ask this next question a couple different ways. First, what specific nutritional advice can PTs provide to patients with, we'll call it musculoskeletal issues, right? Bread and butter orthopedic issues. So what nutritional advice can PTs provide to their patients?
Yeah, so Jimmy, that's a good question. And what happens is there's nuance across the country because of practice acts and what a physical therapist can do. So for most of us across the country, if you keep that information and that education relatively broad, you're in a good spot. So you're looking at general healthy intake, an adequate consumption of fruits and vegetables, good whole grains, things that facilitate, a reduction in systemic inflammation. And with that reduction in systemic inflammation, you're going to see healthier tissue function, right? You're going to see irritation to tendons and ligaments kind of come down a little bit. You're going to see performance increase when there's adequate supply of nutrients. I think also within an orthopedic setting, if you're thinking of your post-op patients, protein is one of the biggest conversations we need to be having, because if you want to facilitate healthy muscle, right, and that healthy muscle turning into improved strength and function, well, you got to fuel it with an adequate amount of protein.
So it sounds as if the safe route, or the appropriate route, depending on your state practice act, right? And there's more than a few of those in the country. It seems like staying on the education side keeps people safe in terms of liability, but also accurate in terms of scope. Is there a resource that you'd recommend? I could see a PT saying, well, according to this organization, this is what they would recommend for someone who is living with your condition.
Yeah, so you think of the national organization, the Academy of Nutrition and Dietetics. So their consumer-facing website is eatright.org. So that's going to be one source to go to, and that's, again, it's very similar to like the APTA, right? But it's for the dietetics and nutrition professional. Outside of that, choosemyplate.gov is a good option as well, because it's got a lot of helpful handouts and resources for patients. How to add more fruits and vegetables to your day, how to get more whole grains, what are your protein sources, how to add more protein to your day. They have some of those nice, easy resources to provide to patients. So that'd be the first place that I would look for those two major websites.
And as an orthopedic physical therapist, you might not necessarily need to go to the lengths that Patrick did, which is to become a registered dietitian. These organizations are vetted. They're, you mentioned a .gov, which is usually we can assume of higher quality. They've done sort of the work, and now by suggesting those, you sort of stay on the side of education and not prescription, correct?
Yeah, because all you're really doing is you are bringing the awareness to the patient that these things exist. They could certainly access them on their own, but you're just creating that awareness. In that, you're not trying to build out a meal plan or dive into the nitty-gritty of what specifically they need to eat, but you're creating awareness to what healthier intake looks like.
Right.
And it's that healthier intake that's going to drive improved recovery.
Right. So generic and so big picture, which is, hey, you should maybe consider eating a little healthier. We kind of know that, right? Now you want to go from strategy to tactics. And it sounds as if the resources you suggested have those opportunities to get tactical. But again, you're not prescribing those particular things. You're educating and suggesting.
Yeah. And, that's, again, Jimmy, where the state nuance comes into play, because realistically, if possible, as an orthopedic physical therapist, you want to find that opportunity to dive in deeper if able, because you can educate people till you're blue in the face that they should eat more fruits and vegetables. Most people know that.
Right.
It's really trying to get into the conversation into finding out why that person doesn't eat X, Y, and Z. And that takes a little bit more skill and a little more knowledge to do so, but it also involves a conversation around the environment that person lives in. But again, the nuance and what you can do and what rabbit hole you can dive into is state dependent.
Yep. How does, you mentioned wound healing, you mentioned, building muscle. Obviously there's a nutrition component to those things. How else does nutrition interact with other forms of physical therapy, treatment, or rehabilitation?
Yeah. So, we talked about that systemic inflammation component. You think of the prevalence of diabetes within this country and how that has impact on, nerve conduction and general healing. There's a good bit of research out there that looks at those suffering from neurological conditions as well. And so if you're in that outpatient orthopedic clinic that you so happen to have that patient who has a history of a stroke or MS or something, there's evidence out there that points to, well, if that person was to consume a healthier eating pattern, there's severity of their symptoms would come down a little bit. I think the other big one to mention too that's related to the systemic inflammation component is people living with osteoarthritis or rheumatoid arthritis. There's a lot of evidence out there that looks, again, if you were to consume more of an anti-inflammatory eating pattern, the symptomology comes down.
Seems as if it's a multifactorial approach, right? Where we're not discounting movement. Obviously, as two physical therapists talking on this podcast, which is brought to you by the Academy of Orthopedic Physical Therapy, it's not saying that we're removing one of the components, but looking at this human from a couple of different aspects or a couple of different sides of that human's life and paying attention to, well, is it just movement? Is it just what I'm going to do with my patient, with my PT background? Or could I be one more touch point for a tactic? And hey, have we considered this? Can I help you? Can I educate you on this?
Yeah, 100%. And it's looking, it's beyond nutrition as well. Like you mentioned earlier, it's things like sleep or stress and having a greater recognition for where that person lives and the environmental influence that they endure, how that has an impact on what you're working towards.
You've been a physical therapist who looks through this lens of also looking at nutrition for a while now. Is there a story where you've seen nutritional changes impact someone's rehabilitation, like something that, someone can picture?
Yeah. So I think one of the most impactful stories I've come across is looking, and this has happened with a couple patients, that come out of surgery. I think they were both the ones I'm thinking of were joint replacement. Maybe one was a traumatic fall and ended up having to have a nailing or something done. But they were having a pretty difficult time with their recovery because the wound wasn't healing. And they were kind of entering into a state of malnourishment where they weren't getting enough of X, Y, and Z. So the body wasn't responding. The wound wasn't healing. So they weren't able to progress in therapy, weren't able to get back on their feet as quickly as they wanted to. So what we did is when we started intervening and recognizing that there was some malnourishment going on, and started having conversations with other providers and the need for protein supplementation. Once that protein supplementation kicked in, which is going to include a variety of other nutrients as well to support wound healing. Once the nutrition regimen changed and that addition was added, the wound started healing as it should. And then once that wound started healing, we were able to get back to more targeted functional activity with improved strength and mobility, and really just progressing that patient where they needed to be.
Yeah. Nutritional changes and changes in movement and exercise, these things take time, right? So it's less of I did this thing and I immediately saw results. So a lot of this, I imagine, has to go with things we've already talked about: education, motivational interviewing, which also comes with a component of listening and building trust to help someone understand this concept of, hey, we've heard you are what you eat, and I think people can understand that, but what you eat or don't eat can affect this thing of movement or pain or rehabilitation or building muscle. And both of these things take time.
Yeah, they do. And that's, I think, probably a challenging thing for many orthopedic physical therapists out there to grasp, is that it does take time. It's not going to be they start eating more protein this week and the next week they're going to be stronger. It's going to take time for the body to respond to that, for that muscle health to improve, to have carryover to improvements in functional strength. So it's not going to be immediate.
Right.
And if you are looking at going down that route of motivational interviewing and behavior change to get that person to start eating better, that's going to take a lot of time to be successful. And so that it's long lasting. You could be looking at something that takes 3 to 6 months to change a behavior if you're trying to get a person to consume more fruits and vegetables or consume more protein.
Yeah, I heard a great mentor in a clinic explain it to a patient, and I was sort of eavesdropping, and they very plainly said, listen, how long do you think it took your behaviors to get us to this point with your knee? And they said, well, probably a couple of years. And they said, well, do you think you're ready to devote a couple months to a few changes to see some improvement to start to work our way out of this? And I think when it was framed that way, not just do this and it will get better in this indefinite amount of time. If I don't see results quickly, I sort of check out as well. And framing it that way with, listen, we're going to do some things in terms of movement. We're asking about sleep and nutrition. We're asking about stress and mental health. And this is sort of the 360 to a human. When it was put that way, it was almost a very educational light bulb moment for that patient, saying, it did take me a long time to get to here. So yes, I don't think a quick fix is actually possible. So I'm willing to invest and commit to that.
Yeah, everything takes time. And, I think the other thing to consider too that takes time from a physical therapist perspective is it takes time for you to learn how to start implementing it into practice. What does that conversation look like? How do you start screening people? How do you provide education information? What's your flow of how you integrate? That takes time. It's not going to be you do it well next week. It takes time for you to start being able to practice more holistically. And what's it look like for you to do it compared to another therapist?
Well, you've educated clinicians on this previously in different facets, presenting at various conferences. At what touch point in sort of the patient life cycle does this come in? Is this something they fill out before they come to the clinic? Is this something you ask in initial evaluation? Is this something you ask on follow-up visits? Like, where are the opportunities to bring this into practice?
Yeah, so it's a good question, and sometimes it depends, but I think there's 2 routes you can go about it, and it may depend on the patient that's in front of you. If you've got someone that's coming into the clinic for their initial evaluation and they're coming to you with a condition or their post-op, and right out the gate nutrition is going to impact their recovery, I'm likely going to start screening initially, right, with that initial eval. I'm going to use some type of food frequency questionnaire or just ask simple questions in terms of what their eating pattern looks like. Are they getting enough of X, Y, and Z to support it? So I might do that out the gate. But if I'm dealing with a patient where after a couple visits, maybe it's something related to chronic pain or some other type of inflammatory condition, they got a nagging tendon that's not recovering, I might start to early on, work on building my relationship and start educating that patient on how nutrition is applicable and important potentially to what's going on. And then once that relationship is established and there's trust, because that patient's likely going to be more of a behavior change, right? If I'm dealing with chronic pain or tendinopathy that won't get better, that I want to establish that relationship and trust, then I'm going to start screening and asking questions, maybe several visits down the road, because the responses I get are going to be very different from if I did it on day one.
Yeah.
That post-op patient's totally different. They know that their life is going to be different after coming out of surgery. They know that they're going to have to make some changes, whether it's weight bearing restrictions or modifying activity. It's, I think, easier early on to bring in, hey, you need to get more protein, you need to stay hydrated, etc. But the ones with the chronic, I build a relationship first, right? Because you're likely going to go down a road of behavior change, and in order for that person to buy into it, they've got to trust in where you're coming from.
Good use of slipping in. It depends as well on a physical therapy podcast. Yeah, it would not be a complete episode unless you did that.
Yeah.
Any other resources? You mentioned some good ones early in the episode. Is there a book out there that if someone was saying, yeah, I want to get a little more educated, is there something that someone has written that you might suggest for a physical therapist who just wants to get a little bit more knowledgeable about nutrition, even for themselves or their patients?
There's a lot of nutrition text out there. I do think some of them are sometimes one-sided, where there'll be more of an emphasis in a plant-focused diet versus a carnivore. So some of that stuff gets kind of, I think, segregated.
Yeah.
We had 2 PTJ manuscripts that we published a few years back that kind of tried to help lay the foundation of what nutrition looks like within our profession and how to implement it into practice. We've got a textbook chapter coming out within the primary care text, the Boys and Not text. The 4th edition has a whole chapter on nutrition where we try and educate, again, the foundation and give the tools and resources to implement into practice. But I'm always hesitant in recommending texts because texts are typically always one-sided.
Mm-hmm.
And I'm not a fan of just honing in on that one thing because there's so much nuance to what a person eats, and there's so much impact to an individual, whether personal or environmental, that influences their decision making. So that's
Well, in this situation, one book does not fit all.
It doesn't.
Yeah.
No, because that's one thing I do caution in looking at those type of books is it's always going to try and direct you towards down one path, but that one path might not be suitable for you. Right?
And we know that the more we learn through research in nutrition and sleep and movement is if 2 people were to do the same diet and the same exercise routine and get the same sleep, they still, because of genetics, would get different results and environment. Those things are still variable. So this is where a skilled clinician comes in and says, these are the things I need to tease out to figure out why we're not getting the results that something else with a similar situation might.
Yeah.
All right. Segment on the show we call the final thought. Anything you'd want to leave with the audience that's listening and still listening after 15 minutes and saying, okay, I now know a little bit more what I might want to learn about in terms of nutrition and bringing that into my practice. What would you want to leave with the audience?
Just start having the conversation. I mean, that's really it. Just start having the conversation and start to get comfortable with having that conversation. The first few patients, it's going to seem very awkward.
Yeah.
And you might get pushback where it's like, why are you talking about what I'm eating when I'm here because of my knee pain? So it might take, empowering or not empowering. It may take you digging into some of the why, what's the connection between nutrition, and so that you can then empower the patient as to why it is important and give that information. But it really starts with, you just got to start having the conversation. And no matter what way, whether it's a standardized screener or you just ask them, hey, how often are you eating fruits and vegetables? What are your protein sources? How much water do you drink throughout the day? Just start the conversation is really the biggest thing, because you don't know if you have to go down the next path of education and resources unless you start having that conversation.
Yeah. And it starts with you. The conversation for nutrition does not make its way into your patient interaction, most likely, unless you bring it in there.
Yeah.
Patrick Berner, thanks for bringing some nutrition into the lives of orthopedic physical therapists and just having this very introductory conversation.
Yeah, appreciate it, Jimmy. Thanks for having me.